Hi, I'm Dr. Kristen DiDomenico with KT&D Ophthalmology Associates here in Philadelphia and Bala Cynwyd. In this video, I plan to give you a deep dive into the world of cataracts. If you or a loved one has been diagnosed with cataracts, this is a great place to gain a basic understanding of what is ahead, which will help you to make the most out of your consult. So let's start off with the term cataract. A cataract is a natural lens that has clouded. We are born with a natural lens shaped like a little M&M candy, but transparent. This lens serves an important role of helping to focus light onto the retina, which is critical for our best vision. The natural lens starts out transparent, but can cloud over time or from an injury or another number of other causes. A clouded natural lens is a cataract, and a cataract degrades the quality of vision. The next step to improve vision, once a cataract becomes visually significant, is cataract surgery. In the next few minutes, I'll tell you what to expect during your surgical evaluation and the procedure itself, a bit about the aftercare, and we'll review some options available to meet your goals. You'll start with a surgical consult, which includes a series of tests to measure the eyes in a very detailed way. You will meet with your surgeon that day to review the measurements and determine your individual surgical plan. Now, a quick 45-second or so sidebar for you contact lens wearers watching. If you are a soft contact lens wearer, it's important to remove your contacts for about 10 days before your visit. For rigid or hard contact lens wearers, I know I'm about to break your heart with this, but it is a minimum of 30 days out of the rigid contact lenses before your testing. Even tougher, we typically recommend a month per decade of hard lens use out of the contacts before the measurements. Now, we understand that the ideal rigid lens holiday may not be realistic for you. When possible, we try to tailor the exact length of time out of the contacts to your specific situation. Expect at least 30 days, though. Once your measurements and examination are complete, we move on to the surgical discussion. Cataract surgery is an outpatient procedure, meaning you go home later that day. A typical cataract surgery is quick, usually about 10 to 15 minutes. You will be at the center for a couple of hours, but most of that is getting you ready for the procedure with a series of eye drops. We usually offer a light sedative for the surgery, not general anesthesia. This means that you will be calm and comfortable, but you will not be asleep. Now, before you start to worry about that, there is no pain during the surgery, and you will not see any tools coming at you, just some colorful lights. We keep it very calm and casual in the room. You will hear some light music in the background, the surgical team members around you. I or your surgeon will be talking to you throughout the procedure. We need you to be aware so that you can follow some simple instructions during the procedure. But it's simple, like, please look up now, or let's turn your head a bit to the side. It's very easy on you as the patient. Once the surgery is finished, you will go to the postoperative area for a bit, and then you get to head home. Most patients will go home feeling a little sleepy if they did receive that light sedative, with a little irritation in the eye, and that's about it. The recovery is pretty straightforward. Most patients feel like themselves by the next day. A little irritation, some flickers to the side, that's all normal. The vision usually recovers within a few days, though certain conditions could add time to that estimate. You will be restricted from strenuous activity for about a week after the surgery. We prefer you have either glasses or sunglasses on if you're in an uncontrolled environment for that first week. There's also a clear plastic shield that you'll sleep with for the first week. More specific details about the restrictions will be given to you at your surgical consult. Now, eye drops after surgery. Many patients nowadays are candidates for a dropless protocol, but not all. If you are eligible, you'll receive the medications inside the eye during the final steps of the surgery to avoid extra eye drops after surgery. Some patients will not be candidates for this for a variety of reasons and may need to use a drop or 2 or even 3 in the postoperative period. Your surgeon will tailor this plan to you and discuss your postoperative regimen in detail prior to the surgery. Now we'll move on to the more exciting part, the choices ahead of you. During the surgery, we will remove your natural clouded lens and give you a new lens inside the eye. If we go back to that M&M candy analogy from the beginning, we open up the shell in the front of that M&M, remove the cataract, then place your new lens inside that shell so that your own anatomy is holding that new lens in place. There are a number of different options for this new lens. At this point, we are not discussing what's best for the health of your eyes. This is now a discussion about what you want out of it when it comes to glasses. Occasionally, an advanced technology option may be recommended because of a risk specific to that eye, but usually it's about the patient's glasses-related goals. We usually talk about vision relating to three main functional focal points. Distance, which is outside of your arm's reach and beyond. Intermediate, approximately at arm's reach, like a computer monitor. And near, that bent elbow distance, a small tablet, cell phone, or printed material. There is a bit of a gray zone nowadays between intermediate and near, with more electronic handheld devices that can be modified to fit certain focal points. Most patients will not be a candidate for all the different lens types available. Your surgeon will review all of your preoperative testing, your current glasses and contact lens needs, and your own goals to customize the list of options for you. But I will now review the current major categories of options so that when your individual choices are given, you're at least familiar with some of these concepts. We will start with the standard monofocal lens. This is the lens that is covered by your health plan. That does not mean that this is an inferior lens. It has pure optics and reliable quality vision in different lighting conditions. It is a monofocal, meaning single focal point lens. With this lens, you would choose far, intermediate, or near. And you would wear glasses for the other distances. Many patients are used to readers, whether it's on top of their contacts, just for smaller print, or even full power readers whenever there's something within arm's reach. I like to stress with patients that if we choose distance vision with monofocal lenses, you will wear reading glasses for everything within your arm's reach. It isn't just reading. If you can touch it with your fingers, expect to wear glasses to see the details on it. I mention this because some patients are thrilled with their distance vision, but they're surprised to need the glasses to see their phones, their watches, to chop vegetables, etc. These are great lenses. You just need to be thoughtful about your planned focal point. Astigmatism correction is another major category. Astigmatism can come from both your cornea and your natural lens, and the summative effect is what would be corrected in your glasses or contacts. With cataract surgery, we're removing your natural lens, so we are now talking about corneal astigmatism that you would be left with. Corneal astigmatism means that the cornea, that dome-shaped windshield in front of the eye overlying the colored part of the iris, that the cornea has a peak or a point rather than being rounded. If you have a significant amount of astigmatism, it would need to be treated during your surgery to reduce the need for glasses. In most cases, astigmatism can be reliably reduced during the surgery by either a femtosecond laser or an advanced technology lens called a toric lens. You can also wear glasses or contacts after surgery to treat your astigmatism if you prefer. It's a very personal decision at this point. Some patients would love to reduce the need for glasses, and some patients just don't share that priority. If you decide you want astigmatism reduction with your surgery, let us determine femtosecond laser versus toric based on the amount and orientation of your astigmatism. Before we move on from monofocals, with or without astigmatism reduction, onto even more advanced technology lens options, some patients may be familiar with the concept of monovision or blended vision. This uses techniques already mentioned to achieve different focal points between the two eyes, which increases the range of glasses independence. However, not everyone is a candidate for mono or blended vision. For full monovision, which is a near eye and a distance eye, You must have tried it before with either contacts or even LASIK. Some patients can be fairly disoriented by the different focal points between the two eyes. Some even get dizzy, so this is not done unless we know that you've tried it and tolerated it in some form in the past. There is an exception to that with the last lens category, which we will discuss today, the light adjustable lens, so stay tuned for more on that option. The next major category includes the extended depth of focus lens and the multifocal lens. Not all patients are going to be candidates for this class of lens. Extended depth of focus means that you would see far through intermediate without relying on glasses. This does not completely eliminate the need for glasses for near work. That said, I mentioned that gray zone earlier between intermediate and near. This EDOF, or extended depth of focus lens, usually allows for unaided use of many handheld devices with minor modifications to font size and at a slightly extended near point. I usually tell patients with this lens you should expect to wear low power readers for normal to small sized print and small things like bills or needlework. Many patients will just keep their readers at their bedside table and their desk and get by glasses free most of the day. The multifocal lens has a bit more near range built in. The multifocal can be a bit less forgiving, so some patients will be a better candidate for the EDOF lens than the multifocal lens. While there are certainly differences to consider between these, the decision between an EDOF and a multifocal lens is often best made by your surgeon based on your testing and exam. This class of lens is fantastic to reduce the need for glasses. But there is a small compromise, and that is a risk of glare, most noticed by patients when driving at night. It is a rare patient who is very bothered by this glare, and it does typically improve with time. This class is a great option for increasing the range of glasses freedom if you're comfortable with that small compromise. The final lens that we'll discuss is the light adjustable lens, or LAL. This is an amazing lens, but with a fairly different postoperative course than the lenses already discussed. We place the light adjustable lens inside the eye during the surgery like any other lens. However, it gets customized by a light delivery device in an office setting, not the operating room, in the weeks after the surgery. The major advantage with this lens is that the power of it can be tailored to your specific goals after the surgery. Some patients have eyes with specific challenges to achieving an exact target. For example, patients with uniquely shaped eyes, or even some who've had prior refractive surgeries like LASIK. The LAL is a great option for precision in these specific cases that were traditionally less precise. Some patients aren't sure which focal point is best for them between intermediate, distance, and near. Some patients are very interested in monovision or blended vision like we discussed earlier, but have never tried it before. These patients can have the power of their lenses adjusted after the surgery to achieve a blended range that's tolerable for them. The adjustment schedule is tailored to the patient and their goals, but we usually recommend patients expect starting 2 to 3 weeks after their second eye surgery that they'll have weekly visits for about 6 weeks with the adjuster to customize the lens power and then lock in that power. Between surgery and the lock-in, patients are required to wear UV protecting glasses to prevent UV light from affecting the power of the lens. Besides the customizability of the LAL, another advantage is that the LAL does not carry the glare risk that the EDOF and the multifocals carry. No matter what you choose, please remember that the choice of lens and aim is not about what's best for the health of your eyes, but about what your goals are when it comes to glasses. Some people try to make lemonade out of this surgery, and some just don't mind wearing glasses after. You tell us your goals and we'll help guide you based on your individual testing and exam. Now, as if you didn't learn enough already, no surgical discussion is complete without discussing some risks. While cataract surgery is very safe and successful, it's still surgery. The risk of complication is very low, but it's not zero. The main risks that we discuss include bleeding complications and infection. Now, the risk of these two is in the order of 1 in thousands. Needing another procedure or surgery on the eye. Also, some patients have a higher risk of a retinal tear than others. The discussion of risk will be customized to your specific case during your consult. The information we discussed may seem overwhelming, but I want you to take away that cataract surgery is a safe, quick, and exciting procedure with a number of options so that you can make the most out of this. We are so honored that you are entrusting your care with us, and we can't wait to guide you on this process of improving your eye health and achieving your best vision. See you soon.